Hello, how's everyone? Today we are talking about the Integumentary System, Chapter 3, Essentials of Medical Language, the second edition. We're talking about the Integumentary System as well as the essentials of the language of dermatology. There's four learning outcomes or objectives that you will be able to understand at the end of this chapter. The first learning outcome or objective is apply the language of dermatology to the skin and its associated organs. The second learning outcome is to comprehend, analyze, spell, and write the medical terms of dermatology. The third learning outcome is to recognize and pronounce the medical terms of dermatology. And the fourth and final outcome is describe the etiology, treatment, and prognosis of common dermatologic conditions. Right here at lesson chapter 3, lesson 1, the first lesson of chapter 3, we're talking about the integumentary system. And please understand, the largest organ of the body is the integumentary system, is the skin. So the integumentary organ system consists of the skin and its associated organs. By the end of this lesson, 3.1, you will be able to use correct medical terminology to 1. Describe the functions of the skin. Second learning outcome, name the tissues in the different layers of the skin. And the third and final outcome of lesson 1 of chapter 3 is specify the functions of the different layers of the skin. Let's talk about the functions of the skin. What does the skin do for us? How does it protect us? The skin performs several important functions. One is protection. The skin is a physical barrier against injury, chemicals, ultraviolet rays, microbes, and toxins that is not easily breached. Next is water resistance. We don't swell up every time we take a bath. The reason is because our skin is water resistant. It also prevents water from leaking out of the body tissues. The third function of the skin is temperature regulation. A network of capillaries in the skin opens up or dilates when the body is too hot. When the body is too cold, the capillary network narrows and the blood flow decreases. Thusly, heat is retained in the body. The fourth function that skin performs is vitamin D synthesis. Do you know as little as 15 to 30 minutes of sunlight daily allows skin cells to initiate sufficient metabolism of vitamin D, which is essential for bone growth and maintenance. The fifth sensation is nerve endings that detect, touch, pressure, heat, cold, pain, vibration, and tissue injury are particularly numerous in the skin of the face, fingers, palms, soles, nipples, and genitals. Alright? The sixth function is excretion and secretion. Water and small amounts of waste products from cell metabolism are lost through the skin by excretion and by secretion from the sweat glands. And the final function that the skin performs is social functions. Yes, even social functions. The skin reflects emotions. Think of when a person is blushing when a person is self-conscious, or going pale when a person is frightened, and then wrinkling when a person dislikes something. All right. So these 6, 7 things, okay, 7 functions that the skin performs is protection, provides water resistance, provides temperature regulation, vitamin D synthesis, sensation, excretion and secretion, and social functions. I want you to understand that the skin is the largest as well as most vulnerable organ of the body. I know that slide right there says in the body, but skin is outside. Okay, yes, there are tissues that are inside our body, but skin is on outside, okay, and it is the most vulnerable organ we have. The skin, I want you to understand, receives more care and treatment than any other body system we have. Okay? Understand that the skin is part of the integumentary organ system. An integumentary organ system consists of skin, hair, nails, sweat glands, as well as sebaceous glands. And so sweat glands and sebaceous glands are inside the body. Okay? However, think of the skin outside, largest and most vulnerable organ. Okay? Think about it. Think about, write down, describe the function that the skin plays in our physical well-being. Think about it, of protection, homeostasis, as well as sensation against injury and social functions. Okay? Think about how our skin also plays an important role in our self-image. Go ahead and write down and describe how does our skin play an important role in our self-image. Okay? Think about this. Compare the appearance of normal skin with that of acne, eczema, and venous stasis of the legs. Okay? Meaning those spider veins that some people have in their legs. Time for word analysis and definition. Take some time. I want you to discuss the difference between the terms biopsy and autopsy. Define carcinoma, and then also define the prefix cryo. Okay? What is biopsy? Biopsy is the removal and examination of living tissue. On the other hand, autopsy is the removal and examination of dead tissue. So that suffix that is up there, OPSY, means to view. The root BI means life. The Greek word autopsy means see with one's own eyes. What does carcinoma mean? Carcinomas, which is a cancerous mass, develops frequently in the skin and travels. That word, when cancer is in the body and travels, that word is called metastasize. Let me spell it for you. Metastasize. M-E-T-A-S-T-A-S-I-Z-E. Let me spell it once more. M as in Mary, E, T as in Tom, A, S, T as in Tom, A, S, I, Z as in zebra, E. Okay? Carcinomas develop frequently in the skin and travel to other areas of the body. Okay? That's carcinoma. The prefix cryo means cold. So think of a word cryosurgery. Cryosurgery is often used in skin surgery, and what this is an application of freezing devices. More word analysis and definition. Let's define these 4 words here. Dermis, dermatology, epidermis, and epidermal. Define those following terms. Now let me ask you a question. What is the practice of dermatology? Dermatology is the study and treatment of the integumentary system. Now, next question. What is the name of the medical professional who treats the diseases of the skin? I hope you answered dermatologist. If you did, you are correct. Dermat, D-E-R-M-A-T /O is the combining form for skin. What's the difference between dermis and epidermis? What is the difference between dermis and epidermis? Dermis is derived from the Greek word for skin. It is the connective tissue layer of the skin beneath the epidermis. Okay? Dermis is the connective tissue layer beneath the epidermis. The epidermis is the outer layer of the skin. That word, that prefix epi, E-P-I, is a prefix for above. Dermis means skin, as does the root derm. So epidermal means pertaining to the epidermis. Continuing on with our third word analysis and definition. For these particular words on the screen here, go ahead and define each term and identify the root. We have cutaneous, and what's the root? You see cutaneous is the root there, C-U-T-A-N/E. Here we have an E as the combining vowel. And that root word, their combining form there, means skin also. Okay? Prognosis. Prognosis. The root here is G-N-O-S-I-S. That stands for prognosis. That stands for G-N-O-S-I-S stands for knowledge. Excuse me. Okay? Let's see. What is the difference between prognosis and diagnosis? What is the difference between prognosis and diagnosis? The prefixes provide the differences here. Diagnosis and pro, right? We understand that G-N-O-S-I-S means having a knowledge about a particular condition. The prefix D-I-A means complete. So diagnosis is identifying an illness or condition. Okay? Prognosis, the prefix P-R-O means before, or to project forward. So the prognosis of this, we're seeing this patient is what? Is a guess. Prognosis is having knowledge about the course of a condition or treatment. Having knowledge. Diagnosis, identifying an illness or condition. Prognosis is having knowledge about the course of a condition or treatment. Here is a picture of the anatomy or the structure of the skin. Begin talking about epidermis here. Alright, so in your textbook, this is figure 3.3. So we want to use figure 3.3 to identify the various layers of the skin. Okay, so and I want you to start with you see there on the right column there at the top. See that word stratum corneum. The stratum corneum is the outermost layer of the epidermis. It is made up of a layer of compact dead cells packed with keratin. Okay, and these are dead cells with no nuclei. Alright? This is the layers of the skin that is continuously shedding. Alright? Dandruff. Dandruff is clumps of these cells that are stuck together with sebum. Okay? Sebum, which is oil from sebaceous glands opening into hair follicles. Okay? Sebaceous glands release an oil called sebum into their hair follicles. And dandruff are clumps of these particular cells that are stuck together. Okay? Let me ask you, taking a look at that picture, I guess it's not real in the picture, but in what structures do you think the stratum lucidum exists? Stratum lucidum exists. And on the picture there, you see stratum lucidum is beneath the stratum corneum. So stratum lucidum exists in our palms, the soles of our feet, our fingers, as well as our toes. Time for more word analysis and definition. Here, with these three particular words, you want to identify the root and define the term. Here, with word analysis and definition continuing on, you have suffix here, in. The suffix in means a substance. So the root word here in keratin is K-E-R-A-T, which means a hard protein. Keratin is protein, alright, which is present in our skin, hair, and nails. Melanin up there, M-E-L-A-N, means black. Melanin is a black pigment found in skin, hair, as well as the retina. And here, with this word analysis and definition, let's define the following terms: intradermal, subcutaneous, intramuscular, and transdermal. Intradermal is within the epidermis. Intradermal. Subcutaneous means below the skin. Intramuscular means within the muscle. Transdermal means going across or through the skin. Okay? So identify the prefixes in these terms. Okay? These particular terms that you see here, intradermal, subcutaneous, intramuscular, and transdermal, these particular terms are used when we are given injections, given medications via injection. Okay? Intradermal is a TB test majority of the time, or an allergy test. Subcutaneous are injections where people are giving themselves insulin. Intramuscular injections, that could be a Depo-Provera shot or or flu vaccine. It goes directly into the muscle. Transdermal, it will say will be a patch. Think of nicotine patches, or think of someone that is having to do having hormone therapy, and they are having an estrogen patch. So these are different routes for injections as well as medication. With the structure of the skin here, transdermal applications are medications placed on the skin that diffuse across the epidermis and into the blood vessels in the dermis. Understand that these medications are placed on a special semi-permeable membrane material that allows for slow absorption of the medication through the skin. So here are some examples, some more examples of transdermal medications. These include cardiac medication, birth control patches, like I said before, nicotine patches, as well as hormone replacements, such as testosterone patches. Okay, these are the purposes of transdermal applications, to be administered through the skin. Here with this word analysis and definition, let's describe the difference in the meaning of these two particular terms, adipose and lipid. Both of these terms mean fat, as you see. Both adipose and lipid means fat. And what's the difference though in these definitions? The adipose contains a suffix of OSE. OSE meaning full of. Okay? A root ADIP means fat. So adipose means containing fat. Please understand, fat has positive effects that help insulate as well as protect the body from injury. Okay? Very, very important. We need to have that healthy fat, that HDL. Lipid, on the other hand, is a Greek word for fat, is the general term for all types of fatty compounds. Okay, when you go get a total cholesterol, they're going to get a lipid panel, includes total cholesterol, HDL, which is high density lipids, and then you have LDL, which is low density lipids. Low density lipids is when they're this liquid, when it's at room temperature, it turns to a solid. Okay, that's low density lipids. HDL, high density lipids, is like our olive oil. These oils stay in a liquid form even at room temperature. Very important to understand the differences of the two. Here we're doing a word analysis and review here with a few newer terms. We have analgesic, follicle, hypodermis, and wheal. Hey, let's take a look at that first word, analgesic. The root ALGES means sensation of pain. The prefix AN means without. So analgesic is a substance that reduces or relieves the response to pain. The next word there, follicle, comes from the Latin meaning small. Comes from Latin meaning small sac. All right. So a follicle is a mass of cells containing a cavity or small cul-de-sac, such as a hair follicle. Okay? Hypodermis means the tissue layer of skin below the dermis, hence the prefix hypo, below. A wheal is a small, itchy swelling of the skin. And when we are administering a tuberculin skin test, we will create a wheal on the forearm, okay, that will have to be read in 48 hours to 72 hours to see if there's a response, to see if the person is positive for having tuberculosis. That concludes lesson 3.1 of the integumentary system, where we are discussing the structure and function of the skin. Now here in lesson 3.2, we're going to be discussing disorders of the skin. Okay? Lesson 3.2 is talking about disorders of the skin. Alright, so please understand the skin shows many of the same types of diseases as other body organs does. So by the end of this lesson, lesson 3.2, you as a student will be able to use correct medical terminology. First learning objective is to name common disorders of the skin. And learning outcome number 2 is to describe the effects of these common disorders on health. Here we see disorders of the skin. We see a picture of an ear. That's a left ear, and it looks like it has two piercings in the auricle part of the ear. Not down at the lower lobe where most ear piercings are. It's up top. And so this disorder that we are seeing here is inflammation of the derma. It's called dermatitis. As it is, it's an inflammation of the dermis caused in different ways. For example, it can be contact, it could be allergic, or it could be seborrheic. Okay? Contact, allergic, or seborrheic. Okay? Let me spell that. S-E-B-O-R-R-E, S-E-B-O-R-R-H-E-I-C. Seborrheic. S-E-B-O-R-R-H-E-I-C. Okay? Those are some ways that dermatitis can happen. So let me ask you a question. Have you ever heard of an allergen? So what is an allergen? An allergen is any substance that causes an immune reaction. Okay? And here's a new word. Let me spell it. Pruritus. P-R-U-R-I-T-U-S. P-R-U-R-I-T-U-S. Pruritus is an itch. We have our next particular type of skin disorder, or dermatitis, is eczema. Okay, eczema is a general term used for inflamed, itchy skin conditions. Okay, now understand eczema, it is itchy. It's an itchy red rash that weeps serous fluid and may become crusted or scaly. Okay, excoriation refers to stretch marks. Excoriation refers to stretch marks. The types of dermatitis here include contact dermatitis, which results from direct contact with irritants or allergens. Okay, and these irritants can be when you change your laundry detergent. Okay, so include soap, detergent, cleaning products, as well as solvents. You have also atopic or allergic dermatitis as well, which is caused by allergens that include nickel and jury. Okay? Perfume, cosmetic, poison, ivy as well. So you remember Miss Fox in your case report here in lesson 3.2. Time for word analysis and definition. Define the root of the following terms: allergen, allergenic, allergy, and allergic. All right? The root here is ERG. The root in these particular terms is ERG. And the meaning of ERG, meaning work, activity. Okay? The root all meaning strange, other. Okay? The root all, the root is ALL, Okay? ALL, the root ALL meaning strange. Okay? Or other. Then we have a root here that is ERD, meaning work activity. Okay? Strange work activity. Okay? Strange work activity. What is the meaning of the element G-E-N? G-E-N. That element, gen in the word, is producing. Alright? So identify the two adjective terms from those listed. Okay? How are you able to tell an adjective? How can you make out of an adjective? And those two suffixes there that end with IC, okay, means pertaining to, okay, and an adjective describes a noun. So that IC means pertaining to, so pertaining to an allergy, okay, or pertaining to something that causes an allergy, meaning allergenic. Here is a picture of a type of skin cancer. Alright, we're going to talk about malignant melanoma, which is a type of cancer that is formed from the cell that produces melanin. Okay, malignant melanoma is a type of cancer that is formed from the cells that produce melanin. It usually begins as an irregularly shaped, like this picture here, black mole, and the cancer cells can spread throughout the body. Okay, remember what we call that when cancer cells spread throughout the body? Begins with an M, ends with size, metastasize. M-E-T-A-S-T-A-S-I-Z-E. Right? What is the risk factor for developing malignant melanoma, you ask? Exposure to excessive sunlight and tanning, plus overexposure to ultraviolet radiation. There are some other types of skin cancer which include basal cell carcinomas. Now this comes from the basal layer of the epidermis. The basal layer of the epidermis means the bottom layer. Alright, the bottom layer of the epidermis is where basal cell carcinomas come from. This really is the most common skin cancer as well as the least dangerous because it does not spread. It does not metastasize. Another type of skin cancer is squamous cell carcinoma. Squamous cell carcinoma. And this comes from cells in the middle layer of the epidermis. Okay? Why is sunlight a danger to skin health? Why do you think sunlight is a danger to skin health? It can cause burning and cause cancers to develop. If you thought of that, you're right. All right? Do you have any problems? Do you have any problems when you are exposed to excessive sunlight? Continuing with disorders of the skin here, we can have infections of the skin. You can have a viral infection, fungal infection, parasitic infection, or bacterial. Okay? So these are the different types that you can have. Here is infection of the skin for viral infections, HPV, human papillomavirus. Okay? So this is a virus that causes warts. Yeah, you can have HPV on your hands like this picture. It's not just down there in the genital areas. Okay? The human papillomavirus invades which layer of skin do you think? That's the epidermis layer. Okay? Alright? So you want to make sure that, not sure how you feel about that HPV vaccination. Okay? But if you have any warts, you want to think about how did you get the virus, okay? And what has the doctor said going to do to help you get rid of the virus? And so because of the rough edges of this HPV, of the warts, okay, it can hurt the outer epidermis cells. Okay, I want you to note the rough projection, right, that caused by the virus of outer epidermal cells. Here we have another still viral infection. Here is varicella zoster virus. varicella zoster virus. Who in here has had varicella zoster virus before? Nobody? You haven't had it? Let me ask you this question. Have you ever had chicken pox before? Okay. Chicken pox is the common name for varicella zoster virus. Okay? I want you to understand shingles or herpes zoster is a condition that can lie dormant and can cause pain later on in life. Okay? A condition that can lay dormant is a varicella zoster virus. Okay? And that's shingles or herpes zoster. This virus is highly contagious. Alright, you want to take a look at shingles, take a look at figure 3.9 in your textbook. Oh, look at the from under cheese. Here's a fungal infection, tinea. Okay, tinea. Alright, the term tinea is a group of related skin infections caused by different species of fungi. Where do fungi live on the skin? They're found on the non-living stratum corneum as well as its derivatives, hair and nails. Next question, that picture up there that you see is called tinea pedis. So where is tinea pedis from? On the foot. It's also commonly known as athlete's foot. Alright? So where are the locations of these following fungal infections? Tinea capitis. Tinea capitis. C-A-P-I-T-I-S. That's the scalp. That's the scalp. Tinea corporis. C-O-R-P-O-R-I-S. That's the body. Tinea cruris. C-R-U-R-I-S is the groin. Tinea versicolor. V-E-R-S-I-C-O-L-O-R is the trunk of body. So understanding that tinea is a group of related skin infections. Okay? And then understanding capitis, corporis, cruris, and versicolor helps you locate where this group of skin infections are. Okay? Here is a yeast-like fungus called Candida and thrush. Let me ask you a question. Can Candida cause recurrent infection? It sure can. It sure can. Okay? Thrush is commonly seen in infants who are bottle-fed, as well as in patients receiving chemotherapy. Alright? Thrush is characterized by white hair-like growths on the tongue and palate. Right? Take a look at figure 3.1 so you get to see what thrush looks like. Alright? So, what is a recurring infection caused by Candida? Name a recurring infection caused by Candida, and that would be thrush. Thrush is a recurrent infection caused by Candida. Now we're talking about parasitic infections. You can have a parasite or you can have an infestation. So what is a parasite? A parasite is an organism that lives in contact with and feeds off of another organism. A lot of times with a parasite, think of a tick. Okay? I want you to describe how an infestation differs from an infection. What's the difference between infestation and an infection? An infestation is a parasitic attack or substance on the skin as well as its appendages. It's an infection. An infection is a disease caused by microorganism that releases toxins or invades body tissues. Infestation is attack. There's a lot of things that's going on there. Okay? It's an infestation of a parasite that has released all these different things release these toxins into our body. Okay, so these are caused by microorganisms. Okay, so that is the difference. Infestations, you're being attacked by the parasite, what the parasites have released in your body. Parasitic infestations, you have lice. Lice are small, living, bud-like parasites, and lice needs a host which to live. Okay, pediculosis is the name of the disease caused by an infestation with lice. So a person has lice, they can, because these lice are releasing toxins in the body, living off of you, okay, that disease will be called pediculosis. What is an itch mite? What is an itch mite? An itch mite is also a parasite, and that lays eggs under your skin. And with an itch mite, this infestation produces scabies. Okay? And the symptom of scabies is just a really, really intense itching. You're really scratching that rash because you're just trying to, because those eggs are underneath there, they may be hatching and starting and going to take root there. And so those scabies is not pretty. Now we're talking about bacterial infections. In here you have Staphylococcus aureus. Often it's shorted, we just call it staph, alright? But the actual term is Staphylococcus, okay? Staphylococcus aureus is the cause of pimples, boils, okay, as a bacterial infection. Let's take a look at these these words here. It's word analysis and definition time. What are the differences? Describe the differences between these terms. Carbuncle, impetigo, and scabies. Carbuncle, impetigo, and scabies. So carbuncle is an infection of many hair follicles in a small area, and it's often on the back of the neck. Carbuncle, okay? It look like it may be called those razor bumps on the back of a person's neck back there. Impetigo is an infection of the skin that produces thick yellow crust. Right? And scabies, as we discussed earlier, is a skin disease produced by mites. Here, diseases of the skin here, you have collagen diseases with SLE and rosacea. Okay, what is collagen again? And what do collagen diseases attack? Collagen is a fibrous protein, and collagen diseases attack collagen or other components of connective tissue. SLE, systemic lupus erythematosus. Okay, systemic lupus erythematosus. Okay, lupus, this particular lupus SLE is an autoimmune disease. Occurs most commonly in women and produces characteristic skin lesions. And the most characteristic feature is a butterfly-shaped red rash on both cheeks joined across the bridge of the nose. Alright, so you may see a butterfly right there, butterfly-shaped rash on their cheeks, joined across their nose. Chances are they have systemic lupus erythematosus. Sticking with collagen diseases, we have scleroderma. And scleroderma is a chronic, persistent autoimmune disease characterized by hardening and shrinking of the skin that makes it feel leathery. Which gender you think scleroderma occurs to most? Which gender you think scleroderma affects the most? If you thought women, you're right. And what organs does scleroderma attack? Heart, lungs, kidney, and organs of the digestive tract as well as joints. Scleroderma is also associated with breast cancer. Take a look at figure 3.16 to take a look at scleroderma. Here we have psoriasis. And psoriasis is itchy, flaky, red patches of various sizes, and they're covered with white or silvery scales. So you could take a look at figure 3.17 for an illustration or picture of psoriasis. Alright, and so then you also have what's called vitiligo. And vitiligo produces pale, irregular patches of skin. Okay, psoriasis and vitiligo, which one of those two has no cure? Psoriasis you can cure, vitiligo there is no known cure at the moment. Word analysis and definition time, and it's time to practice pronouncing the words. So we've just concluded disorders of the integumentary system, and now we're moving on to lesson 3 of chapter 3, which is accessory skin organs. And accessory skin organs include the sebaceous and sweat glands as well as the nails. So by the end of 3.3 here, you will be able to distinguish the different accessory skin organs, identify the structure and functions of the accessory skin organs, and the third and final outcome of this lesson is to describe certain disorders affecting the accessory skin organs. With accessory skin organs, you must use correct medical terminology to distinguish the different accessory skin organs, identify the structure and functions of this accessory skin organ, and describe certain disorders affecting the accessory skin organs. So we just discussed the learning outcomes again for chapter 3, lesson 3.3. Here you have hair follicles and sebaceous glands. So taking a look at figure 3.19, so you can see a picture of the hair follicle as well as the associated sebaceous glands. So again, what do sebaceous glands do? Or what do they secrete? They secrete oily, acidic sebum. That's what they secrete, oily, acidic sebum. What probably triggers an excess production of sebum? And what triggers it is male hormones called androgens. Androgens is what most often triggers an excess of production of sebum. Here is a picture of acne. Alright, take a look at figure 3.20. And acne, what is acne? Hair follicles being blocked by excess sebum and broken down keratin cells from the base of the hair follicle. This forms comedo, C-O-M-E-D-O, a whitehead or a blackhead. So if they rupture, allows bacteria to enter, and then what happens is they form pustules, P-U-S-T-U-L-E-S. Okay? Between the ages of 12 and 25 years old is when people and patients are really prone to having acne. Word analysis and definition time. Let's take a look at these words. You've seen that word cyst before, but let's define these words. Cyst, comedo we just talked about, and pustule as well as seborrhea. Alright, a cyst is an abnormal fluid-filled sac surrounded by membrane. That's a cyst. An abnormal fluid-filled sac surrounded by a membrane. As we said in the previous slide, comedo is a whitehead or a blackhead. It's produced when too much sebum and too many keratin cells block the hair follicles. And then a pustule is a small protuberance on the skin containing pus. Hence the word pustule, has pus right in it. Let's take a look at that S word up there, seborrhea. Okay, seborrhea. The noun is seborrhea, and the adjective is seborrheic, pertaining to, right? Alright, so the suffix here is RRHEA. RRHEA as the suffix means to flow. So when you combine, the combining form SEB/O means sebum, and so seborrhea means excessive amount of sebum. We're talking about hair, okay? And well, we're talking about accessory skin organs. In this slide, we're talking about hair, and then body hair has no specific function. But let's talk about alopecia. What is alopecia? Women have alopecia. You see some, right? And alopecia is thinning of the hair. Okay? Where is axillary hair found? Axillary hair found. Well, where is axilla, right? Under the arms. Axillary hair is found under the arms. And what purpose did hair serve during our evolutionary process? And that's why that up top it says body has no specific function, but based on evolution, hair is there to provide warmth for us. Okay? But what purpose does it serve now? It says it really doesn't serve a purpose for us. But if you think back in the day of cavemen, they had a lot of hair, right? They were out in the cold parts of the world up north, and they had that hair as extra protection. Have you thought about how many sweat glands you have? We humans have 3 to 4 million sweat glands scattered all over our skin. It's concentrated in certain areas of the palms, soles of our feet, and our forehead. And the main function of our sweat glands is not just to produce water, right? But it does produce water, but the main reason why that watery perspiration called sweat, its purpose is to cool the body when we need to. There are different types of sweat glands. Some produce sweat and some produce a smell. Okay? Take a look at figure 3.24 to take a look of the disease of the nails. Disease of nails called onychomycosis. Onychomycosis, alright, is disease of the nails. That's when the nail becomes brittle and cracked. Okay? I want you to understand that 50% of all nail disorders are caused by fungus. Okay? What do you think, what activities you think cause continually moist or damp nails? Frequent hand washing, it being really warm, having poor hygiene, frequent manicures, pedicures without sterilized instruments can cause onychomycosis. disease of our nails. Take a look at figure 3.25 to take another look at a disease of our nails, and that's paronychia. Okay? Paronychia is a bacterial infection of the base of the nail. And the most common bacteria to cause paronychia is Staphylococcus. Okay? Nails can also reflect systemic illnesses or conditions such as hypoxia as well as malnutrition, just by taking a look at the nails, if you know what you're looking at. Word analysis and definition time. Let's take a look at these words: onychomycosis, and paronychia. Let's take a look at these words. Let's break these words down and determine the meaning. All right. So what's the suffix in onychomycosis? What's the suffix there? OSIS. Okay. That's condition. The suffix OSIS means condition. The combining form here, ONYCHO, is the combining form for nail. And that root, MYC, means fungus. Okay? So, onychomycosis is a condition of a fungus infection in a nail. Now let's move on. We have a different, our next suffix in paronychia is the suffix IA, which also means condition. The root here again is ONCYH, also meaning nail, and there is a prefix here. The prefix PAR, okay, alongside. Paronychia is an infection alongside the nail. Now take a look here. The vowel A at the end of PRA is dropped to make that word flow more easily. So the prefix is PRA, but that word there, they drop the A there. Okay, they drop the A there. Okay, so we've just completed lesson 3.3, which was the accessory organs, and now we are at lesson 3.4, which is we're going to discuss burns and injuries to the skin. Understand that skin protects our internal organs. It can be damaged due to many types of injuries. One severe type of injury to skin is burns. So by the end of this lesson, you will be able to use correct medical terminology to distinguish the 4 types of burns, describe the inflammatory and repair process of the skin when it is injured, and then the third and final outcome is to identify local and systemic complications. Here is a first-degree burn. Right? You see a picture, you see a human there on the right there, looks like just got sunburned out there. Maybe she was wearing a bathing suit. Okay? But you looking at figure 3.26, you see that. First-degree burns are also known as superficial burns. All right? How can you get a first-degree burn or superficial burn? With that picture there, it just prolonged exposure to the sun or short exposure to a very hot surface. Now the thing is, with first-degree burns, often it doesn't require any medical treatment and leaves very little scarring, if any. Here is a picture of a second-degree burn at figure 3.26b. This is a picture of a second-degree burn. The question here is, what layers are affected in a second-degree burn? And of course, it's the most outer layer and the very first layer underneath that one. So it's the epidermis and the dermis. The most outer layer is the epidermis and the second layer is the dermis. Second-degree burns are also known as partial thickness burns. First-degree burns, right, was superficial. Second-degree burns, partial thickness, because it's affecting 2 layers, the epidermis and dermis. Now, a second-degree burn requires medical attention and it may produce scarring. What are some signs of a second-degree burn? It will be redness, blisters like here in this picture, as well as severe pain. Here, if you take a look at figure 3.26c, this is a picture of a third-degree burn. Oh my goodness. Third degree is going down 3 layers: epidermis, dermis, as well as the subcutaneous tissue area. So if first degree burns is superficial, leaving no scarring, second degree is partial, okay, partial thickness, and here third degree burns is known as full thickness burns. This third degree burns requires medical attention as well as requires skin grafting. And skin grafting is going to take some skin from a different part of our body to place it in a different part to help with regeneration. Here we're talking about fourth degree burns, and oh my goodness, fourth degree burns destroy all layers of the skin, which includes tendons, muscles, oh my gosh, and sometimes bones. What can cause a fourth degree burn? Exposure to high voltage electricity. What structures do you think would be destroyed in a fourth degree burn? We see it there: skin, bone, muscles, and tendons. And then burn injuries to lungs from heat or smoke causes 60% of burn fatalities. Alright, so they will have to have skin grafts, okay, because there is no dermal tissue left for regeneration. Fourth degree burns is a bad situation. Rule of nines is a process or method that is used to determine the prognosis for burn patients. Okay, it depends on the extent of body surface that is affected. So head and neck are 9% of body surface. All right. So think of front and back though. Okay. What is half of 9? 4.5. 4.5. So head and neck, the anterior part is 4.5, and the back of the posterior part is 4.5. Each arm itself is 4.5. Okay, each arm is 9. All right. But again, each arm has 4.5 in the front, 4.5 on the back. Each leg, 18%, 9% anteriorly, and 9% posteriorly. Okay. So, and the genitalia are 1%. It's these rules of nines, okay, help with the treatment and help explain and communicate the how extreme the burns are. Take a look at figure 3.27 on page 72, so you get to see an illustration of rules of nine. Time for word analysis and definition. Identify the noun and adjective form from the following terms. Identify the noun form and the adjective form. So the first one, you have edema, edematose, you have inflammation, and inflammatory. Alright? So understand, an adjective is explaining the noun. The noun is edema, and the adjective is edematose. Alright? What is edema? Edema is swelling. Okay? What areas of the body you think are prone to edema? Our feet, ankles, lower legs, finger, and our eyelids. Okay? Inflammation is the noun, and inflammatory is the adjective. And what is inflammation? Inflammation is a complex of cell, a complex of cell and chemical reactions occurring in response to a chemical or biologic agent. More word analysis and definition. So here, all of these words, what do they share? All of the words share a common root word, and that root is graft. And graft means what? Graft means to transplant. Alright? So what are these prefixes up here? Auto, homo, allo, xeno, and hetero. Autograft means self. Homo means same or alike. Allo means other, xeno means foreign, and hetero means different. Understanding these and is going to help you when it comes to if you're going to be working in dermatology and communicating with the dermatologist and other healthcare professionals on the dermatology team and or working in the burn unit. Here is a picture. Figure 3.28a is we're talking about here, how do these burns and injuries to the skin, how do they repair themselves? Okay, here is in a superficial laceration, such as a shaving cut, the epithelial cells along the edges divide rapidly, and then they fill the gap to heal. So it's healing from the inside out. Okay? So figure 3.28 illustrates what occurs when the wound is deeper or the skin has been incised. Okay? Then you see blood vessels in the dermis are broken, and then blood escapes in the wound, and then it helps to form a clot. And that is to keep particular bacteria and different things out, as well as to stop the bleeding and to help repair that damaged area from a laceration or an incision. Here in figure 3.28b, this illustration or picture shows what occurs when the skin has been lacerated. After a clot has been formed, okay, what cells arrive to clean up the debris? Macrophages. You see those pictures, those blue pictures right there in the middle? Those are macrophages. And the surface of the clot dries and hardens in the air to form a scab. Right? What's the purpose does a scab serve? It protects the wound from becoming infected. Then after 3 or 4 days, the clot is invaded by new cells, which then forms collagen fibers to form granulation tissue, which then forms a scar. Still talking about burns and injuries to the skin. This picture here, figure 3.31, is a keloid. Okay, keloids form when excessive fibrosis occurs in the wound, making the scar raised, irregular, and lumpy. Okay, that's a keloid picture there. And what is a suture? What is suturing? Suturing is manually bringing the edges of a wound together. Okay, suturing, or you may hear it called stitches. Suturing material can either be non-absorbable or absorbable, and now they have liquid adhesives. Okay, learners, this is word analysis and definitions, and this is our last slide of Chapter 3, Integumentary System. Let's take a look at these 4 words down here. What do the following terms have in common? Abdominoplasty, blepharoplasty, mammoplasty, and rhinoplasty. Of course, you're taking a look at that. It's blaring. It's the suffix. Those group of letters at the end. Plasty. This means surgical repair. So abdominoplasty from the root abdomino is a tummy tuck. Blepharoplasty from the root blepharo is eyelid. That's the correction of defects in the eyelids. Mammoplasty from the root mammo is breast. That's the surgical procedure to alter the size or shape of breasts. And rhinoplasty from the root rhino means nose. Is the surgical procedure to alter the size or shape of the nose. I hope this PowerPoint was helpful for you. You have any questions, please send me a message or write the questions down so we can discuss them if you need to. I look forward to serving you and helping you with medical terminology. Thank you.